Another source of these medications are minerals, that is, the rocks and other detritus that we see that are part of the earth, part of the crust, part of the makeup of the planet itself. One of the favorites is gold. Now, from gold, we can have a medication called aranophen, which treats rheumatoid arthritis. Another source is something called potassium chloride. Potassium is a very important chemical within biological systems. We call them electrolytes because they have either a negative or a positive charge. If electrolyte levels are out of balance, this can cause significant problems, particularly at the cardiovascular level. Potassium levels are often tested in patients, and if those levels come back too low, this puts the patient at risk for a malfunctioning cardiac system. So supplemental potassium may be given. One of the versions of that potassium is known as potassium chloride. Think about tar. Now, we can find natural tar up into the Santa Barbara area where it seeps out of the ground where it's been collecting for millions of years. One of the ways we can do it is for skin conditions. Perhaps the patient has flaking, dry skin underneath their hair, dandruff. They can use a coal tar extract. One of the products is known as Neutrogena. Another thing we can use it for is we can coat it on the skin, and it's been known to help treat psoriasis. People use minerals to help supplement their overall diet. Now, these minerals include things like calcium and iron. Now, these are normally non-digestible, so we usually bring them in as food sources. And this is still and remains the best way to consume these different needed chemicals. But we can and do add them as supplements, things like vitamins and mineral supplements. These supplements are very good for what's called trace elements, these elements that we don't come across in our everyday diet, or because of modern farming techniques, in many cases, some of these chemicals have just been completely stripped from the soil. And even if we're eating properly, we may not get adequate nutrition because these chemicals are missing from the food because they're missing from the soil. These are like copper, magnesium, selenium, and zinc. Medications can also be derived from either molecular or genetic manipulation. In molecular manipulation, changes are made to the actual molecular structure of the medication. And we often use computers and computer-aided design, or CAD, to help us accomplish these tasks. These types of computers and arrangements allow the chemists and the researchers to rotate or change the shape of these chemicals. Now, this is important because a little later, if you follow these series, you'll find out that in many cases, these chemicals that are being used for medications rely on these receptors. Receptors are kind of like keyholes. If I put in the proper object, I'll be able to activate this receptor and have something done. Good example of this is some of the antidepressant medications we use. If I'm using molecular manipulation, what I can do is I can physically change the chemical 3D component of that molecule until it properly fits into a receptacle that it wasn't originally intended for. Now I can occupy that receptor for various reasons. Either I can block it to prevent another naturally occurring chemical process to occur, or I can stimulate it in the absence of a chemical process. So in the first example, I might want to prevent the body from reabsorbing a chemical called serotonin. In another example, I may be giving a patient something called thyroid because their body is not able to make sufficient amount of thyroid. All of these are accomplished because of different things like receptors, and those can be accomplished synthetically if I'm allowed to take the chemical itself and start changing it until it fits into the biological structure that I want to change. An isomer is a molecule that's similar to another molecule, but it differs in its arrangement and position of atoms in chemical bonds. It has the same number of atoms, it has the same type of atoms, they're simply arranged in a different way. And in this example, we see an isomer and how even though we have the same amount of chemicals and we have the same chemicals, we see by looking at the green, black, and white circles or spheres which represent those chemicals that they're simply rearranged. They're essentially in the same pattern, but where those atoms are in this molecule has been rearranged. This is an example of an isomer. If I have a mirror image isomer, these are drugs which look either left, but when then I look on the other isomer, it's right, and it looks like I'm looking in a mirror. This one's to the left and this one's to the right. And by the way, There are medical terminology to help define this. The term dextro means right, and the word levo means left. So I would add dextr or levo to my chemical to identify whether it is a right-sided isomer or a left-sided isomer. We can create medications that are similar in structures but are not isomers, because remember, if I'm an isomer, I have to have the same number and the same quantity of atoms, simply made in different arrangements. So computer-aided design helps us to simply try different patterns over and over and over that in real life would take tens of thousands of years, essentially. We can do this quickly because of the rapid processing power of modern-day computer technology. Let's look at some examples of chemical and molecular manipulation to create new drugs. A good example is penicillin. Penicillin at first could not be taken orally. If I took it orally, it would have no action because my contents of my stomach would destroy the chemistry. By adding a few more molecules to the penicillin molecule, they created ampicillin, and ampicillin is safe and effective if taken orally. Another example is when they created Allegra. The reason Allegro was created was because the older school antihistamines, such as Benadryl, were associated with heart problems as a side effect. By simply taking the chemical structure of diphenhydramine, Benadryl, and changing it, modifying it, it now becomes fexofenadine Allegra, and that causes the antihistamine effect without causing the heart disease. Let's talk a little bit about something called transplantin, which is an ineffective cancer treatment. However, if I take transplantin and I start to use the isomer concept on it, what I do is I start taking inside of this medication is a functional part. I remove and manipulate the chemicals, so now this active part comes forward. This is now what's known as a cis isomer medication because the active part has moved from one side to the other. And this coisomer medication, where the transplantin did not have any effect, we now have something called cisplatin. And cisplatin is a very powerful medication used as chemotherapy to fight cancer, including bladder cancer, ovarian cancers, and testicular cancers.